Hello, my name is Miguel Amigot. I'm the CTO of IBL Education, and I'm here with Dr. Mark Braunstein from Georgia Tech's OMSCS program. Can you, thank you for being with us today, Mark. Can you please tell us about your course, the health informatics, the problem that we're solving here?
Well, healthcare around the world faces similar challenges. In all the advanced industrialized countries, people are living longer. Their lack of proper diet and exercise is leading to growing rates of chronic disease. All health systems also suffer with problems delivering the highest quality and most cost-effective care. Now, for decades, we've felt that the use of information technology would be a key to overcoming these and other challenges. But the progress has been very slow. I joined the faculty at Georgia Tech about 11 years ago and developed an introductory health informatics course. Actually, it didn't introduce anything because there were no other health informatics courses. And over time, I realized that a project-based course was a much more effective tool for learning than a didactic course. Now, a few years ago, a solution to one of the great challenges health informatics faced, which is how do we represent healthcare data in a standard way so that it can be meaningfully shared. A solution to that began to be developed, and I became interested in it very early and saw the possibility of using this technology as a platform for student projects. The technology is called Fast Healthcare Interoperability Resources, or FHIR, F-H-I-R. We won't get into the technical details, but it's really using the technologies that are widespread already on the internet to represent and access healthcare information. And it is a natural platform for writing healthcare apps that might run on your phone or on any sort of computer device. So we began organizing things with the support of Dean Galil and others to develop a programming platform on campus so that our students could work with domain experts. These are physicians from places like Emory University or researchers from places like the CDC to develop real apps that might actually in time be used to take better care of patients or improve public health. When OMSCS came along, I was very interested in trying this idea as an online course. Now it's got special challenges. Running project-based courses is difficult even on campus. There are a lot of moving parts that have to be managed. And given the nature of the way we do projects and the scale of the OMSCS program, a particular challenge was actually finding enough projects, enough domain experts who would mentor the students to do a project.
Got it.
We were somewhat lucky because FHIR has really taken off. In fact, earlier this very week, it was effectively made a U.S. standard. The Centers for Medicare and Medicaid Services, which pays for most healthcare in the United States, has now mandated that FHIR must be made available for both patients and providers, physicians and others, to access healthcare data. And we've already had some dramatic developments, such as Apple embracing the technology so that patients can aggregate their healthcare records on their phone. So a lot of people are all of a sudden interested in doing these projects. Secondly, the implementation of FHIR has started to move to the point where these projects, if they're meritorious, can actually be used in actual patient care. In fact, I met just yesterday with an OMSCS student from here in the New York area who had taken my course and worked on a project with a dermatologist at Emory University. And he was very excited because the app that he and his team developed is going to be used in actual patient care later this year. Emory is now at the point where they're starting to deploy fire and fire apps.
Got it. So from a pedagogical standpoint, can you talk a little bit about the project-based experience that the learners go through, especially if you are, coordinating actual real-world projects? Right? How does that work?
Yes. Well, we've gotten better at it over time. I must say, early on, it was a struggle. We actually now have a self-service portal, so people who are interested in doing a project with our students can go to a web page and can submit their project. It has to go through an approval process. One of the difficult issues is, can we get make-believe data assembled that is acceptable and realistic enough to support doing that particular project? For obvious reasons, we can't use real healthcare data in these projects. The other thing is managing so many projects. I guess by OMSCS standards, this course is relatively small, but relatively small has meant we were handling 200 students. This last semester, that was 350, and my colleague John Duke, I'm actually on leave doing some other things, is teaching the course, is gearing up to go to 650 students. With, let's say, 6 students a project, that's 100 projects.
Yes.
So that's a challenge. And it turns out one of the absolute keys are the teaching assistants. Because no faculty can possibly interact with 100 projects and 600 students. So the projects are assigned to teaching assistants, and the enthusiasm of the OMSCS students to get involved, to be teaching assistants is just incredible. So in fact, we won't accept someone as a teaching assistant unless they've taken the course. And all of the teaching assistants in the OMSCS course are OMSCS students. And that's really what makes it possible.
Interesting. So,
and in fact, we've actually had OMSCS TAs who themselves have proposed projects and have mentored.
Oh, wow, okay.
So, I mean, it's really just incredible.
No, I mean, clearly it has worked fantastically well.
Yeah, well, so far.
Well, so do you feel as though this is able to maybe set a model or a precedent or a framework for other, let's say, other technical courses in online degrees as to what a project-based learning experience should be?
I don't know if I can say that or not. I can tell you that there are some other universities that are interested in trying to replicate what we're doing in our domain. Also, because of the evolution of this technology to really, it's not just a US technology, it's a global technology. Yeah. The demand for students who have skills in developing, using this technology is exploding. And we've been asked to look at what we could do to create some sort of standalone professional certificate program based on the experience we've had, which would mean scaling the number of students up by maybe a factor of 10, maybe more. So that's an interesting challenge, but one that we're taking a good look at. It just exemplifies the power of this kind of instruction. These students are generally adults out in the workforce. They're generally taking these courses while they're also managing a job and a family. Mm-hmm. And if you talk to them, they will almost all say if it weren't for a program like OMSCS, they couldn't access this kind of education. They're remarkable students. They bring to the course and to the projects a great deal of real skill in developing computer software and in project management. So That's good. They really don't need as much mentoring in terms of that aspect as the on-campus master's students do. We also, of course, teach this on campus. There is a bit of a challenge because it's all virtual, but it's remarkable to see how the students use the social media tools that are available to interact with each other and interact with us, and it works.
Clearly, okay, that's fantastic. And do you feel as though this is something that, obviously, I mean, we're seeing all of this emerge, so to some extent it's to be determined, but let's just say in a completely self-paced format, right? Do you feel as though this project-based experience, specifically in the health informatics course, is one that could be replicated, with a fully, say, machine-graded system?
Well, we're using quite a bit of machine grading currently. The students do activities and programming exercises, and all of those are machine graded. The interesting question is if we're going to try to scale this beyond a Georgia Tech credit course and think in terms of something bigger than that. You've raised one. I mean, it would have to be self-paced, obviously. So our methodology of having live, real domain experts mentor and interact with the teams over the course of a semester probably doesn't work when everybody is proceeding at their own pace. So we would probably have to have sort of canned projects that students can work on. It's not crystal clear to me that a team works either when everyone's self-paced. So there are a lot of things to think about.
Got it. No, okay, well, that's fantastic. So, I mean, it's very, very interesting. Clearly, you've set a model for other programs, other universities, many other people to follow, and specifically in the health informatics course with FIRE and everything, there is a lot that we're looking forward to.
Yeah, people have definitely paid attention. I mean, when I go to meetings, I never go to a meeting anymore without somebody coming up or several people coming and say, I took your course. Or I also have a public Coursera MOOC. And it's so wonderful to hear the stories that people tell you about how meaningful it was to them to be able to take this course. I will end with a story that actually goes back to my Coursera MOOC. This is pre-OMSCS. It went up public one weekend for the first time. And that weekend, I got an email from a student thanking me for making it available because it's a field he's always been interested in studying but had no way to study. The student was a physician in Namibia. I actually had to get out of...
It's amazing.
Had to get a map to see exactly where he was. So it really is incredible.
No, well, that's fantastic. Yeah. Mark, congratulations, and yeah, I think we'll keep in touch, and very excited to see where everything goes in the future.
Thank you.
So yeah, thank you.